So we've looked at your hand, and what you have is called Dupuytren's contracture. This is a disorder that tends to run in families, as you know, and it's essentially due to your genetics. But what it causes essentially scar to form under the skin, and as the scar becomes mature, it shortens, and that then pulls your finger down, and that is called a contracture. And you can bend the finger either at this joint, which is called the metacarpophalangeal joint, or this one. And those two tend to behave differently. Now, the way to treat this is essentially you can't cure your genetics, but what you can do is you can break the cord that is formed under the skin and thereby correct the bend. So that is what you're trying to do. And you can do that in one of two different ways. You can either do it with surgery, where you open up the skin there, find the cord, and cut out a small bit. Or you can inject the cord in clinic, and this is an enzyme called collagenase, which then softens the cord. We then bring you back into clinic, give you a bit of local anesthetic, and snap the cord. But of course, you're doing all that in clinic as opposed to being admitted in hospital. And patients commonly feel that if we're doing something in clinic with an injection, that it is a less invasive thing. But there's lots that we don't know about this. And essentially what we don't know is which treatment is better. There are no studies at the minute that compare the injection to the surgery. But there is information only about the injection or only about the surgery. And what that tells us is three things. The first is, what my patients want to know, you want to know, is this thing going to improve and get corrected? Now, if you operate, then 3 out of 4 improve completely. But if you inject, then half improve completely. And 1 in 5, you get no improvement at all. So we know that from a point of correction, is it going to improve your contracture, that surgery seems to be giving you a greater chance of improvement. The second thing that patients want to know is, so what is the risk? What might go wrong? If you have the injection, then around 30% of patients get complications, but most of these are minor and resolve very, very quickly, so we don't tend to get too worried about it. The main complication that we see if you inject and then snap, do the manipulation, is that the skin can split. And if the skin, that happens in 1 in 10 people, and if it splits, we don't worry about it too much. It heals up really quite well, but it takes another few weeks as it heals up. The serious complications of the injection are things like you're getting infection, you'll get a red line forming up your forearm, and you might get some lumps in your armpit. And that is uncommon, but you do see that now and again. The really serious complications, like the enzyme digesting the tendon and causing a rupture, is very, very rare. Now, if you operate, then the risk is 1 in 5. Remember I said it's 1 in 3 with collagenase, much lower risk of all complications with surgery. But and most of those are quite minor. But the chance of getting something that will leave you with either numbness or stiffness is a bit higher with surgery than with the injection. It's about 1 in 15 will get either numbness or stiffness after surgery. But the surgery is straightforward. Again, you might leave small gaps open after surgery, and those heal over a couple of weeks. But we get you moving straight away, and sometimes need to give you a splint. The third thing that patients want to know is, how likely is it that the contracture is going to come back after surgery? There's going to re-bend down. And both treatments can lead to contractures coming back because we haven't changed your genetics. But we know at the minute from all the information we have that if you operate, then around 12% will come back in 3 to 4 years. And if you do this injection, then around half come back in 3 to 5 years. So slightly more come back after collagenase injection. So at this point in time, we do not know which treatment is better. So the NHS and the government has set up this national study for us to be able to see whether doing something in clinic is at least as good as operating. Because if it is, then we can offer that to all patients. It's not commonly being offered in the UK at the minute, but that would be the intent. It's only sensible to do that if we can demonstrate it is as good as in a proper study, which has not yet been done. So what we're trying to do is encourage patients like you to consider joining a study like this.